Hey friends, I hope you're having a fantastic day. And today we are going to talk about Candida overgrowth and its effect on your joints, your muscles, your tendons, your ligaments. Do you have chronic pain in the joints? Do you have chronic muscle stiffness? Do you have symptoms of fibromyalgia? Do you have unexplainable pain when you get up and walk around? And many people say it's just old age, but you didn't really exert yourself too heavily. You didn't bump into a door frame. You didn't hurt yourself, but you still have that pain that's in the joints and in the muscles. If you know you have yeast infections, Candida overgrowth, then just know that it can contribute to chronic muscle and joint pain. And we're going to talk about that in this post. We're going to talk about how it can occur. We're going to talk about some simple supplementation to help clear it out of the body. And we're going to talk about some other therapies or other techniques to help flush it out gently and safely. So, Candida, remember there's many forms of Candida, are actually not all bad. Forms of yeast are in your body to help you do a few things, many things, but let's talk about that in the structural aspect. It helps clean out your joints. Yeast will be in the joints helping to clean up debris. They eat up certain debris to help flush out certain toxicities within the joint. They also are in the gut. They help do what? Keep bad bacteria at bay. So there's a symbiosis. Remember guys, the yin and the yang, the symbiosis, the balance that keeps things flowing properly. Now, in America, when we have improper diets, remember, higher sugars, higher carbs, higher simple starches can actually feed the yeast. And when you feed something too much, it grows and reproduces, and it starts to produce what? Toxins. They poop. They eat, they poop. The poop is the toxin that can build up in areas like the joints, the muscles, the lymph nodes, and the organs. So if you think about it, you have to see that they have the same mechanics as we do. Eat, drink, sleep, poop. And so where does that waste go? Well, if you have a healthy liver, healthy detox system within the digestive tract, and healthy lymph nodes, you'll flush them out properly. But let's say that you had an old hip injury, an old work injury, an old sports injury, emotional instability that was triggering certain organs and imbalances with certain muscles associated with certain joints. That can happen. We're going to talk about that. But let's say the yeast builds up around that injury to help clean it up, or in the organ to help clean it up. And then in the standard American diet, we eat a little bit more foods that are higher in sugars and carbs, and it feeds the yeast, it overgrows in that particular area, and so it starts to create more acidity. It creates a bit more organic acids because that's their waste, and acetaldehyde. It also produces ethanol. Yeast feeds off ethanol, and it can feed off certain forms of aldehyde if they're not broken down properly. Remember, ethanol is alcohol. And so yeast can feed off of it. It can also produce it. Does it make sense? It can produce acetaldehyde and alcohol, and it can feed off some of those things as well. Different forms do different things. All that to say is that toxicity buildup within the joints or within the organs can definitely have association with the muscles around the joint or around the organ, giving you muscle stiffness and pain. Think about when they embalm bodies. They use formaldehyde. Aldehydes. Aldehydes are very toxic to the system. They're very nerve damaging. They actually dumb down the nerves. They make the nerve transmission slower. So anywhere you have yeast overgrowth, whether it's in the shoulders or in the hips from an old injury, there's going to be decreased nerve stimulation and signaling because of the aldehydes or the formaldehydes, the acetaldehydes that are in the body. You can see these things with phenol toxicity or toluene toxicities. There are so many different types of organic acids, and some I can't even pronounce, but they're produced by toxicities or microbes, and they build up, and they can hinder and injure a muscle. So once you start to clean out the yeast, the Candida, gently and safely, remember, restoring balance, not just about killing off, but restoring balance, you'll start to see ease within the joints, and you also start to see strengthening within the muscle. So remember, yeast will produce the toxicity, and you don't need to start pulling them out. Now, some minerals help that with the aldehyde aspect. I like to use molybdenum, and molybdenum has helped many of my patients get the toxicity out. There's a great product by NutriWest called molybdenum chelate, and I say that I use this weekly on patients, giving them a small amount of molybdenum through the week to help flush out the acetaldehyde. But that's not the only thing. So put that on your checklist, okay, by NutriWest molybdenum chelate. Also, when we talk about the Chinese medicine aspect, remember, if you had old injuries, old sports injury or work injuries, and yeast builds up trying to clean out the system, and then we eat too much and it overgrows. In the Chinese medicine aspect, remember that every organ in the body also is associated with a certain muscle. There's a connection between the organ and the muscle. So they're connected by the nervous system. There's a link, and it's also connected by the acupuncture system, the electrical flow through the fascia. Okay, so there's two ways, guys. Now, if you have a small intestine problem, if you had SIBO, if you had high amounts of Candida within the small intestine or even in the large intestine, in kinesiology, those muscles are often associated from the small intestine to the quads right here, and the abdominal muscles. So let's say you had Candida overgrowth, and if it gets too much and the toxicities like the acetaldehyde or any of the organic acids build up too heavily, or even if ethanol is produced, you'll see that the gut will actually get weaker. You don't have enough core strength. Your quads get weakened, so then the hamstrings actually have quite a bit of a load to take on because the front of the legs are weaker. Does that make sense? There's a counterbalance. So you'll start to see this chronic weakness within the abdominal muscles and the quads just from the small intestine. And so that changes the core balancing within your body, which can give you problems within the hips, the knees, and the ankles, going all the way up to the neck. In fact, if it gets too crazy, it can actually cause the pelvis to go out of alignment, causing a corkscrew effect up your spine, putting a lot of pressure throughout the spine, even to the neck and the TMJ, causing cranial dysfunction. That is the whole aspect of craniosacral dysfunctions, or even treatments and therapies. They want to correct the cranium and the pelvis to help create alignment between the head and the pelvis. So you see how this inflammation or this chronic infection of the gut or the small intestine can turn off those muscles. In fact, think about the large intestine. It's associated with the hamstrings and the glute muscles. If you get Candida in the reproductive, it can go into the G medius, which is the hip muscles on the side. It gives you your lateral stabilization. If you have it in your bladder, it can weaken the calves. It can weaken all the back muscles. So you see that in kinesiology, I put that applied kinesiology chart yesterday. I may take another picture of it and set it up, but I want you to just write down applied kinesiology muscle organ relationship, and you'll see how muscles are related to weakness in organ, and that's in acupuncture as well. So you see that not only that the infection within the organ can cause a muscle imbalance, here's the process. If you have yeast in the joint already, if you have yeast within in the digestive tract, remember that nerve signal, that fascial signal from the acupuncture system is all in around those joints, and they get hindered. And then what happens to the joint? Think about like if your knee was meeting, like you had the femur bone and the tibia, and they're sitting there moving properly, and all of a sudden you get stiffness within the muscle, and they start to grind a little bit when you walk. You hear that grinding, popping and snapping? Well, grinding creates what? Friction. Friction leads to heat. Heat leads to inflammation. The body goes, there's too much heat going on. What's going on down there? So it starts to create swelling because it puts the synovial fluid around the inflammation to help create coolness, to cool the body down. And then you start to get pain because you have the inflammation. So you have imbalanced muscles creating this pain within the joint. And then if the joint's unstable, the related joints, the ankle, the hip, they start to suffer because they're trying to take the brunt of the weight. Pelvis starts to get out of alignment. Now that can all happen from an infection. People say, how does an infection cause joint pain? Just like that. And if it was already in the joint from a previous injury, it could be a double whammy. So the body is doing all it can to balance. So most people say, well, let's just go kill off all the yeast. I'm like, we don't say kill off all the yeast, because that's why I recommend like a GI map test. I just sent one off this morning. A GI map test is really good to see what type of infections are in the digestive tract to find out if there's a probiotic that's needed, a prebiotic, or any type of herbal spice that help balance that particular infection. You just don't want to go and try to kill off every yeast because some may be beneficial to you. So look into GI map testing, all right, guys? So we know how it causes it. Acetaldehyde, ethanol is being produced, organic acids in the joints. Also imbalances in the organs can create instability within the muscles, which leads to the pain and stiffness within the joint. And that toxicity, if it gets into the lymph nodes, if it spills out into the muscle tissues, if it gets into the bloodstream, can cause overall toxicity, overall fibromyalgia type feelings, and can cause what? The muscle tissue to actually what? Weaken. So you feel weak, you get the shakes. So there are ways. I told you about molybdenum. Check it out. Look how it affects with that kind of acetaldehyde toxicity, a chelator. And we're going to talk about a few supplements. I love using Candida Supreme. I talk about it a lot. It's noni. It's really good for gut dysfunction and cleaning out infections within the digestive tract. Always start slow. Check out the website, supremenutritionproducts.com. Look at their research. I like their dosages. I always start with half the dosage and then work my way up to full dosage if the patient feels good, sleeps well, and has good bowel movements. If you feel bloating or distension or feel pain after you take a supplement, just don't do it anymore and find the other ones that may be helpful for you. I like Thera Supreme because it increases qi within the kidneys and within the digestive and reproductive area, and it's a very good antimicrobial, a broad general aspect. I also love to use Thera Supreme. Thera Supreme is a combination of blackberry and blueberry and pomegranate and cilantro, and what it does is cleans out the joints, especially with people with solanine toxicities like nightshade problems, potatoes, green peppers, jalapenos. Those kind of vegetables can build up the joints, but it's also been good with my patients who have arthritis. Remember, joint pain, like arthritis, can be contributed by Candida. So Thera Supreme cleans out the joints. Mangista is like a cousin of turmeric and curcumin. It helps clean out the lymph system. It's a good lymph mover. Try these, look into them, guys, and see if the dosages start off slow, but you don't have to take all of them at the same time. Ask your primary care physician if these are things that would work well for your joint pain and instability within the body. But find a good holistic practitioner that can assess and test if you have Candida overgrowth and see if you can start flushing them, start using some of these supplements. We're going to go over a few more in the chemistry section to give you guys a little more of an arsenal about what to do to help gently clean. So these four I mentioned help really clean out the joints and help get the lymph moving, all right? Even the molybdenum. So I want you guys to research these, check into them, and see if these are for you. Remember which one resonates with you. Also, a couple therapies before I go. I think infrared saunas are great. I think they help flush, but you don't want to do them too quickly and too harshly if you have high amounts of Candida. Maybe once a week for 15 minutes or so if you're in infrared sauna or infrared light therapy. Also, bounding, doing some form of bounding like jumping jacks or being on a trampoline will help loosen the lymph every morning, 5 to 10 minutes. Don't get yourself to where all that aldehyde's in your head and you feel too dizzy. Just do it for maybe 3 to 5 minutes if that's the case, but get the lymph moving to start pushing that junk through your liver to help you expel it in your morning bowel movement. I also like to do foot baths, ionic foot baths. I think lymph massage is really great. So if you guys can do a lymph massage, find a good lymph practitioner that doesn't push your body too much, but is nice and gentle. And maybe do that once every 2 weeks or maybe once every week and a half. These are some options, guys. Try to find them. I always suggest acupuncture, a good chiropractor, a good kinesiologist, a good osteopath, a healthcare practitioner, a good functional medicine doctor. Find the one that resonates with you. All right, guys, this is how it affects your joints. You can get rid of it. Remember, Thera Supreme, Thera Supreme, Mangista, and even Miranda. These are options. Look into it on their website, and you can start cleaning it out. I hope this was good and educational. Guys, hope you have a great day. Love y'all. Take it easy.